Good afternoon, everyone. Welcome to the Eczema Association of Australasia Inc. and the Eczema Association of New Zealand Inc.'s More Than Just Skin live Q&A webinar for Eczema Awareness Week 2021. My name is Michaela Vandenberg and I am a Corporate Membership Officer for the EAA and EANZ. Thank you so much for taking the time to join us today. We hope you learn some great tips, information and resources on how to effectively manage your eczema, but also learn about its impact on mental health. To begin, I'd like to introduce you to our panelists. Let me just bring up the presentation. Bear with me, there we go. You should now be able to see the presentation. Wonderful. So to begin with, I'd like to introduce to our panelists for today. So we've got the president of the EAA and the EANZ, Cheryl Tallant. We've also got the head of dermatology at the Westmead Hospital and professor in dermatology at the University of Sydney, Professor Pablo Fernandez-Penaz, as well as Claire Harwood, a severe eczema sufferer of over 30 years. These fantastic panelists will be providing you with some great insights into eczema and how you can effectively navigate this condition, both physically and mentally. In today's session, we will learn more about the EAA and EANZ and Professor Fernandez-Penaz, as well as Claire's experience before we head into a Q&A session. If you have any questions while Professor Fernandez-Penaz, Claire or Cheryl Tallant are presenting, please be sure to write your answers in the chat on your control panel. We will then be responding to these questions in your Q&A time. If we run out of time and are unable to answer your questions, please send them through to either help@eczema.org.au or give the EAA a call on 1300 300 182. This session will be recorded, so we will be sharing the audio visuals from the webinar onto our website and socials if you need to refer back to this once the webinar is over. We hope you learned so much from today's session and welcome any feedback in our post-webinar survey that you will receive once the session has concluded. I will now be handing over to Cheryl Tallant, who will provide you with a bit of background information on the EAA and the EANZ and the importance of understanding the condition for yourself, but as well as your mental well-being.
Hi everybody, and welcome today. We know that eczema is very difficult to deal with, but that's why we're here as a support group. So the EAA and EANZ provide support and education for eczema sufferers and carers, along with the wider community in all aspects of eczema and its impact. We're here to help you. Next slide. The EAA and EANZ both are non-profit organisations, incorporated bodies, registered charities in Australia and New Zealand, have public benevolent status, a medical advisory board and international links. Next slide. So we know that managing eczema to prevent flares is a constant battle for most sufferers and can have a major impact on their daily life. It can be very debilitating to suffer from eczema, and unfortunately, as a disease, it's not given the credence it really deserves. Every year we run 2 awareness campaigns. So this webinar ties in with our May Eczema Awareness Week, which we run every year, and we also run Eczema Awareness Day in September. These are the 2 key times of the year when people experience the worst flares, when they're eczema sufferers. We're also members of the International Alliance of Dermatology Patient Organisations, which is a global organisation, also known as Global Skin, and where we do a lot of work trying to gain worldwide knowledge that we can then bring back to our own country and utilise for the benefit of long-term and all those seasonal sufferers. We also have some wonderful corporate supporters, otherwise we wouldn't be able to keep doing what we do. And we do get some assistance from Queensland Health because we are based in Brisbane. We offer our members many tips through our social media channels to help manage their condition. We know that there's not one thing that helps everyone, but there's many things you can try that you can really use to manage your eczema a lot more successfully. We also produce and distribute the only dedicated eczema magazine in Australia and New Zealand, which is our Eczema Quarterly, and our members and other professional people and that really appreciate the work we put into this magazine and the help we provide to sufferers. It just makes them feel as though they're not battling alone all the time. We also produce and distribute our Caring for Your Eczema brochures, posters, patient information sheets, lots and lots of resources which can be utilised to really help you get some good results for managing your eczema. Atopic dermatitis, or eczema as we know it in Australia usually, is the most common inflammatory skin condition in adults and children. While we know there's no cure for eczema, dealing with it can be difficult as well. We know that stress is experienced by every sufferer, and managing it, is really difficult. We all know what being stressed feels like, or what happens when we're stressed. This stress often leads to physical symptoms. It's demanding both physically and mentally and emotionally. And it's bad enough when you have what we call normal skin and you have stress, suffer from stress, sorry, but when you have eczema, it can play a huge role in your skin disease. Eczema can exacerbate stress. It doesn't actually cause eczema stress, but it can make it worse. However, often the level of stress does not necessarily relate to the condition of eczema. Sometimes people with comparatively mild eczema can suffer extreme stress. Eczema can be very challenging when it comes to mental well-being. Anxiety and stress are common triggers that can cause eczema flare-ups. A vicious cycle begins when the skin condition causes scratching, which inflames the condition further and causes more stress. So the condition just goes round and round in a cycle or a circle. Next slide. So it's really important that stress management for people with eczema, as well as their family and caretakers, is something that we look at for most eczema sufferers. Knowing how to properly manage and control eczema flares that are caused by stress can relieve symptoms of anxiety and depression and improve emotional well-being. Next slide. So here at the EAA and EANZ, we don't have all the answers. We know there's no cure for eczema, but we can certainly support you and help you, point you in the right direction for further treatments, help you with lots of educational literature. And at the end of the day, just be a shoulder to lean on or an empathetic ear on the end of the phone. So please let us help you. Give us a call or email us. Thank you.
Well, thank you so much for that, Cheryl. I would now like to introduce our next speaker, eczema sufferer Claire Hardwood. Thank you so much, Claire.
Hi, thank you. Firstly, thank you for this opportunity to let me speak to you about my own eczema journey. I hope that this small insight into my own journey and some tips that I'll share at the end of this slide will help others in their own journey. Next slide. So the next few slides is just giving a bit of an insight into my journey. So my eczema presented itself at 2 weeks when I was 2 weeks old. My parents were told that it was something that I would grow out of by 7. At 7, I was told that I would grow out of it at 14. At 14, I was then told I would grow out of it by 21. And at 21, I was told it was just something that I would have to manage and live with. Through the early ages with my eczema, I don't have many photos. This was due to the fact of just shame around the way it looked and those thoughts and feelings of I'm just not pretty enough. So I would avoid the camera at all costs. Next slide, please. From the early years of eczema, it was clear to me that it was more than just a skin issue. It had an effect on many aspects of my life. Through my teenagers into my early 20s, I had a lot of negative self-talk. I felt really misunderstood. I felt really alone, and I felt really unlovable. It put me in a really scary place with my self-talk, and it got to a point where I was sitting Googling, does having eczema want to kill yourself? And then it became a bit of a vicious cycle in feeling quite negative about myself, but then feeling bad for having these quite scary thoughts. Next slide, please. Sorry, I've lost my train of thought now. So it presented with both physical pain and other factors. And it really it took its toll on the relationships around me. I started to feel like a burden to my family and friends. Through my schooling, I missed a lot of school through sleepless nights or being really itchy, which really affected my learnings and my friendships. In my 20s, I began to cancel social plans, again through sleepless nights or just not feeling good enough to go out into the world. And also those irritable, like having those sleepless nights and being so irritable. So getting really frustrated with people. And again, like I said, just not feeling understood by people around me. Next. I think Cheryl mentioned it, but it is important for me to mention again, what might work for one person won't necessarily work for another person. And that is to do with my skin, but also the mental health. So when I share my tips, I understand they might not help you, but I think it is important to try these things in both areas of the skin and the mental health. Next slide, please. As you can see here, I have listed some of the effects of eczema on my mental health, and these are just to mention a few, but I definitely stepped into a lot of self-doubt, worrying about what people thought of me, how I looked. I always felt really dirty, and like people wondered what people would think of me when they looked at me. That feeling of, I've had it before. Are you contagious? Am I going to catch that? Which again, that really affected my mental health, not feeling good enough for the world. The effects on my relationships and friendships, the breakdown of that by cancelling social plans, depression and anxiety, the self-harm thoughts, which was a really scary place to get to with it, and unable to focus. So missing work, missing school. Those are just to mention a few of the mental health side of things. Next slide, please. For me, some of my tips with managing my eczema, I think it's important for me to say that in no way have I got it completely under control. I'm quite maybe lucky in the sense that my eczema is quite seasonable. So right now in Melbourne, well, it's going into winter, so I probably will present myself with flare-ups. But now I have a lot more tools to manage it. And a big one for me is consistent. I think through my teens, I just wanted those quick fixes and I didn't put in the time or energy and I wasn't consistent in it, be that moisturizing or, having bleach baths, which really works for me personally. But also I wasn't consistent in seeking professional help for the mental health side of things. So that's a really big one. Being kind to yourself, I think for me, that negative self-talk and changing that and finding ways to deal with that. And that really helped me seeing a professional to find out the skills to change that self-talk. It's still there sometimes, but I now just can reword it and restructure it. For me, when I do have flare-ups, getting some vitamin D, as I mentioned, the moisturizing is really important. Being kind to yourself, be gentle with yourself, and surrounding yourself with the right people that can understand you and hold empathy for you, I think is really important. And they're my sort of basic tips, but I definitely have more. So I'm happy either in the Q&A to answer some of those, or I think like Michaela said, or Cheryl said, if you want to email them through, I'm more than happy to share. Thank you.
Wonderful. Thank you so much for sharing, Claire. I think so many people watching today can relate to exactly what you said. And, like you mentioned, it is so important to be kind to yourself. I will now be handing over to our last panelist, Professor Pablo Fernandez-Penaz. So yeah, take us away from here, Doctor.
Hi, hello to you all. Let's see if you can move to the next slide. And I'm so glad to be participating in this session. Eczema is a very complex condition, probably because I have this Spanish blood and I'm a little bit Latin. I do feel with my patients, and I've been always interested in quality of life and the impact of diseases in the quality of life of our patients, and skin diseases in particular, because of how visual they are. So before going into the impact of eczema in the life of you and other patients, of our patients that they come to our clinics, I wanted to go quite quickly about what is eczema. So if you can move to the next slide. So one of the things that you need to understand is that our skin is a barrier. If you click again, as this should be just one slide, but it's coming as a different thing. So on the right, you have what would be a biopsy of the skin with the different layers, and the top part of the skin is the stratum corneum. So if we click again, this is just showing the epidermis, and the epidermis has different layers and it's only cells. If compared to other structures that are collagen and other fibers, here they're only cells. And these cells, they multiply in the deeper part of the epidermis and slowly move up to form the stratum corneum that you have on the top of the slide. And that's the barrier, and that's why we have a skin, just to build this wall. And if we move to the next slide, this wall, that is the stratum corneum, that external part of the epidermis is made by bricks, and these bricks, they're cells that are transformed in blocks of proteins. So it's good that our patients, they eat properly. We need proteins to build the skin, and if there's not enough proteins, the epidermis is going to suffer. And the second thing that we need is a mortar, a glue that get all these blocks together, these bricks. And interestingly, this is greasy products, they're lipids. And this explains why dermatologists, we always talk about using greasy products to moisturize the skin. It's because we want to restore the wall. And if many of the soaps that people they use, or not almost every soap, how it works is that they remove the greasy part of the skin. And when you remove the greasy part, then the blocks, they don't hold together and the epidermis gets broken. And then it's easier for any product to get into the body. We know that people with atopic eczema, probably they have some problems in these bricks. Just get to the next slide. And when the skin gets inflamed, water gets into this part of the skin called epidermis. And when it gets inside the skin, and you can see in this slide as histological under the microscope, the fluid accumulates and creates small vesicles. So if you scratch your normal skin, so if I now scratch my skin, I would never create anything, maybe a little bit of redness. But if there's some eczema, there's an inflammation, what we call technically a spongiosis. So if water is getting into the epidermis and you scratch, you're gonna break it because you're breaking those small vesicles, that empty space that you can see on the slide on the right. And I'm sorry that I cannot manage the mouse to show you there's that vesicle. And that's what makes, yes, if you move more to the right, more, a little bit more, up. Yep, that hole there, yes, that's the hole, that is a vesicle. That is all this fluid that is between the cells that get together, form this vesicle, and this is what it breaks and makes the fluid come out. So if we go to the next slide, and this is the experience that every patient, move this, go ahead. I don't know what this slide is here. Move on, this, click forward, sorry. Yes, yep, and this is what we have. When all these vesicles, they break, suddenly is when your skin gets whippy, and then the fluid dries out and you get the crusty. Okay, so and because they're fluid from inside the body that gets out, That's what is the food for bacteria, as I said in the last line. And this is good terrain for bacteria to grow. But killing the bacteria does not fix the skin. So it's not many of you will have the experience of using antibiotics, but we need to reduce the inflammation. We need to restore. If there was no fluid coming out from the body, there would not be any bacteria. So move to the next slide. So what are the mechanisms of eczema and atopic eczema in particular? So there are many, and so many that really we don't think that there's one eczema. And that's the reason every patient, every person has a different experience with doing things and their skin responding in a way or in another way. So it's not a defined disease. It's not like an infection and now we have COVID-19. You know, we know the virus and it's this virus and we can kill the virus and we use vaccines. Well, eczema is way more complex, has multiple factors and different people, one could be predominant to another factor. We know that there are genetic factors. The most common is this mutation in a protein called filaggrin. This talks about the hereditary component, why it runs in families. But when we look at families with eczema, not every family has filaggrin. In fact, we can only explain around 30%. So that means that there are many other things that we're missing out yet, and we need to find out. Environmental factors, yes, we know that is more frequent in developing countries, and that has given to the hygiene hypothesis. And if we are protecting so much our immune system, that immune system creates funny reactions in the body. It may be also reporting on how much we consider eczema in one place or another, but certainly there could be something. Of course, immunology is involved, and we know that there's cytokines and IgE, and we're going to talk a little bit more in the next slide. And then this neurobiology complex. So there's peptides, neuropeptides that transmit signals from the skin to the brain and the other way around. And that's what you heard before. It's not that stress causes eczema, that certainly makes eczema worse. But having eczema is going to affect our brain, not only just because it's visual, not only because it's itching, is that there are other neurotransmitters that they come from the skin to the brain, sending signals. And of course, there's a lot of psychological implications and factors that we are going to talk later on. Just move to the next slide. So this is just to show you many of the things, not all of the things that we know about atopic eczema. All these molecules, all these cells, all these drawings that you see in this slide, they're talking about different cells that researchers are looking into why they're a factor in eczema. And these IL-31, IL-4, IL-5, they're communication system. This is called interleukins, and it's how cells communicate to each other to send messages. And now we're getting molecules that we can interfere specifically in some of the messages between cells. So we know a lot about eczema. We know many mechanisms that are involved, but we also know that not a single medication, not a single modification of the whole structure is going to improve eczema in everybody. Next slide. And one of the important problems in eczema, and I bring it here because it's part of the effect in quality of life in mental health, is itch. And itch is part of the spectrum from touching to pain. And we touch things and we ignore many things that we touch, and we feel pain and then we move. But itch is telling us that we need to scratch, and really has been designed by nature for that. It has been designed as an alarm system to detect many parasites or insects or debris that are on our skin, and we need to remove. So we feel itch. The problem is that itch gets so intense in patients with eczema. And you need to think that the skin is the biggest sensing organ, because we can sense things from our toes to our scalp from every part of the skin. So it's way bigger than our ears, our eyes. We tend to consider those the sensing organs, but the biggest sensing organ really is the skin. And when the ears are shut down, the eyes are shut down. So we're talking about at night, that is an experience that most of you will have. when no other organ is sending signals to the brain, the only organ that is still sending signals to everybody is the skin. And that's what makes itch so bad at night. And unfortunately, itch and pain, they share very similar pathways. So the only way that many patients find that itch stops is when they cause pain on the skin. And that means that you scratch so bad until it bleeds, or really so painful that then is when you can stop scratching. And we need to find new ways. Get to the next slide. Unfortunately, many people have thought that the main mechanism for itch is histamine. This slide is just to tell you that all these leads in the first column, all those molecules could cause itch and are mechanisms involved in it. Histamine is the first one that you see in the first row, is the one that everybody uses. You could use an antihistamine, and that's prescribed by many doctors. Unfortunately, in eczema, is not the histamine the main mechanisms. For some people it is, and I'm not denying. Some people, they take their antihistamine, they feel better, but many others, they don't, because the mechanism is the inflammation, the scratch that creates inflammation. And so there are many molecules, and some of them we already can treat them and can manage them. Then we have neuropathic mechanisms, psychogenic mechanisms that are also involved in itch in eczema. Go to the next slide. So if we talk about quality of life, and skip this one, I didn't know the order, so you already have heard Claire talking about the impact. And this is a meme just to explain the same thing as Claire was saying about her experience, looking at everything is going to be good, and suddenly the skin goes ballistic and you don't understand why things they're happening this bad. Go to the next slide. So what we know is that people with eczema, they suffer a lot of problems with self-esteem, because they, as you see, 60% of patients with eczema, they feel bad about being touched or being seen. And you have heard those, and probably many of you have this experience. 1/3 of patients, they feel that people, they're looking at them, they impact their social life, they feel bullied, and even they find difficulties finding a romantic partner. So this is not for you all that have eczema. This is for those of you that are in the webinar, that you know someone with eczema, or you've got a relative with eczema, or you want to know about eczema. So people with eczema, they're feeling all these things. If you think about, 4 people with eczema, half of them, more than half of them, they don't want to be touched or seen. And 1 or 2 of them, they will be feeling any of these issues about impacting their social life, or being bullied at work, or in the school or at the school. So most people, they're a group of people that they feel very dissatisfied with life. 16% somewhat, and 11% very dissatisfied with life. Next slide. And as I said, this influences social life and school. So feelings of shame makes that kids, they avoid the sports, almost half of the kids, or they avoid social activities, or patients with eczema miss a lot of days of work. They 40%, 4 out of 10, will select a different job just to avoid a job that they think the eczema is going to impact, like being a doctor, being a surgeon. You need to wash your hands all the time. You're going to have with eczema all the time, or working in a kitchen. So those things make you think about the job that you're going to do. 11% of the patients in this study described that they felt discriminated at work, and 14% believed that the career progression was damaged by their eczema. Next slide. And itch is one of the multiple things. Being physical disease, and that people can see, that's those aspects that we have been talking before, that happen to many other skin conditions. It happens from vitiligo, that is losing the color of the skin, to psoriasis, that is another important condition. In any skin condition, discrimination, being bullied, being considered that that's going to create problems, happens all the time. People, dermatologists like me, that we're more conscious about our patients, we see this happening with all the skin diseases. But it is something very peculiar about atopic eczema. And 90% of the patients, they report every day having itch. And as you read in the slide, 68% they have itch more than 4 times a day. And I know that many of you feel even more than 4 times a day. And it's impacting everything, impacting social life. You're with someone and you need to scratch, and you find that that's very confronting. So you're holding your hand, so you need to leave that place. But also, if you're a kid and you're at the school, and every time that someone is talking, the teacher is talking, but you're distracted because you need to scratch, at the end, attention gets affected. And that impacts in many other things, as we're going to see in the next slide. Next slide. One of the things that is very affected is sleep. 87% of the people with eczema have problems falling asleep. And 74% they declare that they eat always, all the time, or they wake up from sleep scratching. So sleep is shorter, and that increases to daytime sleepiness, to insomnia and fatigue. So you're all the time sleep deprived. Or if you've got, again, as I said, a relative or a friend with eczema, remember this. These people, they're always tired. Not because they look tired, that it looks, because eczema gives you that face like being tired. No, they really are, because they're 10 times more fatigued than the rest of the population. Next slide. And all these different elements give an increased risk of depression, an increased risk of anxiety. And what is the main problem, as I explained in the last line, is that patients are rarely screened for these conditions in most clinics. I have to say that at Westmead Hospital, in our severe eczema clinic, we always run a quality of life instrument, because we want to assess how our patients are doing in their normal life. And many of you, and now I'm talking to the patient with eczema, when you come to the doctor and the doctor say, how are you doing? You reply, I'm doing okay. Compared to how I was before, I'm better. But that doesn't mean that you're good. And a quality of life instrument make this very objectable. We have a number, we have discrete responses for different events that we want to know. So we've been running for many years, quality of life instruments in our clinic. Next slide. And what I said about attention, atopic dermatitis increases the risk of attention deficit and hyperactivity disorder, and is, as a global thing, as you see, 14% more frequent in children and 61% more frequent in adults. But when we look at what are the groups that get more affected, and that's the table that you have, the first line is talking about what's the risk if you're not having adequate sleep. You only have up to 3 nights a week that you're sleeping okay, your risk will be 83%. If you've got a little bit of atopy, the risk will be 56%, okay? 1.56 means that is 56% higher chances. But when you've got severe atopic eczema and you're sleeping more or less okay, the risk is 3 times. So that combines severe eczema, even if you're sleeping well, 3 times the risk of having ADHD. But when you have severe atopic eczema and you don't sleep well, the chances of developing this condition is almost 17 times. So that means that most people with atopic eczema, they have a risk of developing this condition. Next slide. And the arrow should go to the first line. This has been published recently. It was a WHO review of the disability by many things and many diseases. One was related to skin conditions, and if you see of all the skin conditions, dermatitis, that is another word that people they use for eczema, is the highest in impact in the world. And this is because it's so frequent, because it affects kids to adults. It's because of the impact of sleep and itch that is way higher than other diseases. You will be surprised to see acne, but acne affects most people in the teenage years, so have a huge impact in quality of life. And one disease that everybody talks about is psoriasis, and it's just in the top 4. So as you see, there are many skin conditions that have huge impact in the disability in humanity. And if you go down the list, you will see that melanoma, that is an important skin cancer that you're having here all the time news. Here in Australia, we're talking about the most damaging skin cancer, melanoma. The impact in the life of people is not as high as is eczema. And there's a lot of money involved in research in melanoma, and we want to have as much research happening in eczema to improve the life of patients. Next slide. So all this psychological impact, what is the appearance, what is the sensation, but on top of that is the time that it takes to control and manage the disease, the amount of money that all the creams, all the product that you need, the clothing that should be different and adapted to you, and the stress that the disease generates. All this is the whole cloud that is around eczema. Next slide. So what should we be doing? What we need to do? I think that patients with eczema at the personal level, they need to learn, but learn from appropriate sources. There's too much magic. I understand that magic looks okay. And in eczema, I'm gonna explain this. When we do our clinical trial, and clinical trials, they're very well organized studies, we compare an active treatment with a placebo. And we know that we're giving placebo. That means something that doesn't work to some of our patients, but the doctors that we're giving the treatment, we don't know what it is. The patients that are participating in the trial, they don't know what they're receiving, only someone external. Okay, when we look at the results in good treatments that are being approved now in Australia, we have that 3 out of 10 patients on placebo, 3 out of 10 patients, they have a good response. So it could be that we're more, they feel that we care more for them because they come more often. They could be that they're more strict in the moisturizer because it's necessary for the trial. There could be many things, but certainly 3 out of 10 they get better. But when we look at the treatment is 6 or 7 people out of 10 that get better. So that's the reason we know the treatment works. In the same condition, the treatment works, makes more people better. But what I want to say about the placebo is 3 out of 10 found that something works. So many people, they come to me and say, I use this and this works for me. I'm fine with that. But don't think that because it works for you, it's gonna work for anybody else. It's always too difficult. Eczema is a very, very complex disease. You've been hearing about tips, and I think that that's the thing. It's a tip that worked for me is how my skin looks like react better, but maybe not. So learn from sources that has appropriate information that will help you to develop and manage your eczema. You need to understand the disease as much as possible, but not your own disease. It's too complex, I think. Some of my patients, they get very confused. Just understand eczema as such, understand that there are many mechanisms. And the last thing is engage with the health system. I know that many of you, you're not happy with how doctors and the health system treat you. Look like they're not understanding. And I'm not going to deny that there are many types of doctors and you may be unlucky, but there's good people around, good people that they want to do the best for you as a patient, but sometimes they're not magic tools. We don't have amazing treatments. And anything that you commence in the middle of the flare looks like it's going to look like works because you get better. And when you use something when your skin is okay, it looks like it's giving you trouble because it gets worse. But really, eczema is like this, there are flares, and the flares, they disappear and they back to normal. It's too difficult to understand what are the specific things. All of you that you have relatives with eczema, please support them. Understand that they're gonna get too crazy. They want them to understand their disease, and it's too difficult to understand. Support them to get information, support them to go to the health system, those things, and support them in their work, in their studies, in everything that they need. And as a community, I think that we need way more understanding in the community, because still, as you have heard before, people with eczema, they feel very discriminated. And then from the health system, well, we need to educate many of our GPs and many other specialists that are not trained in skin on what eczema means. Some people, they reduce eczema just to a tablet or to an injection. And yes, there are many tablets and many injections, and we have many new treatments that could work, but it's way more than this. And that means that we need to teach people about the comorbidities and the mental health impact. So I think that the health system should have more specialized units. I know that there's a few for kids and many kids hospitals that they have eczema units, but there are not that many in adult hospitals. I don't know if there are more than my unit here at Westmead, but I've been always very, it's important eczema for me personally and personal level at the level of my patients, and I wanted to create this unit. So we're running one specialized unit, and I think that is needed for adults too. We also in the health system, we need to measure severity in all the spectrum of the disease, not only skin severity, that is one, also the age, sleep impact, and the mental health impact. And one important topic for doctors and specialized doctors in particular, and I will talk about dermatologists, is to do early intervention. The sooner that we control the eczema, the better our patients are going to do in the future. So I hope that you find doctors that they want to treat you early and appropriately. But I know that many of you may be scared about taking tablets or doing things because it's only skin. And I have this discussion with some of you. I don't know if any of my patients is listening to this, but it's not only skin, and taking tablets is okay. You're saying me that I have no glasses, but really the only way for me to work in this life is wearing my glasses all the time. So I could say, no, I don't want glasses, because if I use the glasses, I'm not a normal person. People with diabetes, they need to take their tablets or their injections. We need help, and people with eczema, sometimes they need help in form of injections or tablets. So it's good to use treatments. It's just the way to have, if possible, a normal life. Next slide. And I think that I took it longer than I hope. So the last slide is just the final slide. You have my email, pablo.fernandezpeñas@sydney.edu. If any of you want to contact me, and hopefully I haven't taken too much of your time. I'm happy to take any question.
Wonderful. Thank you so much for those wonderful insights into eczema and mental health, Professor Fernandez-Peñas. And thank you for your bravery in being able to open up and share your own personal experience with eczema and the mental health implications, Claire. We will now be jumping into our Q&A session. So to start with, we've had some questions from registrants who weren't able to join us. So we'll go through these first, and then we'll jump into the great questions that you've been asking us throughout the session. I'll hand over to Cheryl, who will be introducing the questions and then handing them to each appropriate panelists. So over to you, Cheryl.
Okay, hi everybody again. Those oversights were absolutely fantastic. Sorry, here I am. Sorry about that. That presentation was wonderful, Dr. Pablo, and it really, hopefully, will make people understand what people with eczema are going through. And same with you, Claire. I mean, I do recall going out for dinner with my ex-husband, and we got home and he said, all you did was scratch all night, and I wasn't even aware that I was sitting at a business dinner scratching my head. So I think with a lot of people it'll ring a real chord. But we've got some questions that have come through. So the first one is for Claire. Claire, you mentioned travel helped reset your thinking of your condition. Now that we can't travel, how have you managed? Do you have any advice on how to approach family and friends for other sufferers who are being impacted mentally?
On ways to reset myself. Sorry, was that on ways to reset myself, did you say?
Yeah, it should be how you manage your life now that you can't travel.
That I can't travel. Yes, I think travel really helped me. I mean, I'm based here in Melbourne, so I found when I was traveling, I actually didn't get as severe flare-ups through other parts of the world. I was living in London thinking, oh, it's I'm going to have such a major flare up there. But something about Melbourne through the winter months really does affect me. Unfortunately, I need to go up north, I think. But for me, like I did mention in that, through the winter months when I am having flare ups, it's to reset myself. I suppose it's just walking was a really big one for me. So still moving my body. Obviously, like you said, Pablo, sport is really hard because, you know, excessive sweat can really affect it, but just gently moving my body can help me feel grounded. It might take me away from those like severe just itching where I'm just at my skin, and just resetting me. But just communicating and keeping communication open with my friends and families. I used to be stressed or anxious about missing social things, so I would go and cover my skin up in so many clothes and not let it breathe, where now I just have more confidence in saying, well, yeah, I've got the skin, this is what it looks like, and not being so stressed about the image of it. Or if I need to cancel plans, I have that network of people who understand, and I think that's really helps, like which I mentioned, surrounding yourself with the right people who understand that I might not be able to do everything or don't feel comfortable doing everything. That's helped me.
Cheryl, we cannot hear you. You're mute now.
Sorry, I'm having trouble with my microphone here. I was just saying it's important to surround yourself with people who really understand and are not judgmental. Sometimes you just have a bad day, don't you, with your skin, and you just don't feel ready to face the world. Yeah. We have another question for Dr. Pablo. Accessing mental health plans through GPs. I asked my GP for a mental health plan during a long and exhausting facial eczema flare. I was really surprised that my GP told me it was not appropriate, and I was really disappointed by this, as I know a mental health plan would have helped me enormously with dealing emotionally with having eczema, especially facial eczema. Is it common for doctors to refer mental health plans for emotional distress from eczema, or don't they usually do it?
So that's a problem for a specialist. We can't do it. We don't have the capacity to send our patients to a psychologist. So we refer them back to the GP for them to consider to get a mental health plan, because unfortunately it's not in our hands, and it's not covered by the MBS, so we cannot have a psychologist in our team here. That's one of our ideas. If we were to have enough funding, is to have our own psychologists in the Department of Dermatology, because many of our diseases put a lot of pressure in our patients, and they will benefit from having a personal specialized psychologist in the group. So at this stage, we send them back to the GP. One of the options in that case is to go to the dermatologist, explain this to the dermatologist, and the dermatologist probably will understand much better the needs for a mental health plan, and probably with a letter from the dermatologist that could be achieved. Cheryl, I cannot hear you again.
Sorry, I've got someone muting me and I'm trying to unmute myself. The next question, Dr. Pablo, is can you outgrow eczema? We get asked this all the time.
Yes, so yes and no. You cannot outgrow your genetic component. So we don't know what that is. And what I said to my patients is that you've got sensitive skin, and your sensitive skin could have a threshold to create eczema. And some people, they have such a almost high threshold that as soon as the skin matures during the infancy, when they go to the adolescent, then eczema is not a problem. But you know what happens when they get into their very adult years, they get to the 60s or 70s, eczema starts to be again a problem, because the skin is not as thick as it used to be. But many patients with eczema, they don't, and with the more and more use of soaps and use of products on our skin, and the different fibers that we use. If we were to use all the time cotton, probably will be better. But you know, we're adding small damages, and the damage could be a little bit of a stress, could be a product that you're using on your skin, could be different fine type of clothing, and that built up until you cross the line. And once you cross the line, you get inflammation, and once your inflammation, doesn't matter what triggered at the beginning, it gets ballistic. We're just moving in a different world. It's the scratching, it's the inflammation, it's just doesn't matter all the things before. So outgrown eczema as such, we used to say a lot, but I wouldn't trust it. I will say to everybody, you've got sensitive skin. If you're lucky because you're doing the right products, your mental health is okay, you're not scratching much, the people around you, as Claire is saying, is supporting you, probably you outgrown eczema, so it's not going to give you trouble, but it's always a risk. You've got sensitive skin.
Mm-hmm.
Yeah, I totally agree. And I like to say to people, especially kids that have had eczema as babies, and it clears up. But sometimes, you know, we know it sort of goes into remission, and they can often go through a period later in their life and it'll come back with a vengeance, which is exactly what happened to me. So my next question, again, Dr. Padlow, is can eczema be related to a certain allergic reaction?
That's a very complex. I will say that when we talk about eczema as a general thing, we classified eczema in two big groups: contact eczema and endogenous eczema. Contact eczema is when something that we apply create a problem, and you've got irritant and allergic contact eczema. So we've got allergies in that regard. But the endogenous generalized, like atopic eczema, on the skin rarely is an allergy. A different thing that happens is that people with eczema, with atopic eczema, just because the skin is permeable and things they go through and the immune system is unhappy, they have higher chances of developing rhinitis and pollen allergies and asthma and more external allergies. So there's a very complex mix between any allergen, and maybe that's the reason Melbourne is not that good for Claire. That could be in the environment. That allergen makes the immune system to be a little bit unhappy, and then a product that she's using in Melbourne will give havoc because the immune system is already in alarm. But you go to Malaysia or London would be the perfect place in Europe, is the place for eczema. You go to another completely different country and the same product, the same clothes, the same everything look like it's not created any problems, just because the immune system is more relaxed because something else that is coming from the nose or is coming from the breathing, coming from other places is not stimulated. It's too complex, the interaction, but most of the eczema that we see on the skin is not an allergy. And another twist, we know allergic contact eczema is 20% of females, and you're two here with me, so it's difficult to know if any of you're going to have it, but I'm sure that there's a lot in the people that are listening. 2 out of 10 females, they cannot wear custom jewelry. That's what we call nickel allergy. Okay, nickel allergy is 20% in normal population, and is 20% in eczema patients. So they're not more allergic, even though their skin is broken, and in principle, they could be more easily allergic. So for many years, we were saying that people with atopic eczema, they don't have such a hyperactive immune system, but the immune system is different. How I said to patients is that it's funny, but I don't know if funny is a right word to say. I'm a Spaniard.
Okay, good to know. All round, it's a very complex skin disease, and I think we're just finding out now that it's not just a skin disease. As I said, there's a lot of things that, a lot of factors that make up this disease. Claire, I have a question we've been sent for you. You mentioned that winter causes flare-ups for you, and that's why we run Eczema Awareness Week in winter. Do you have any tips for other Australian sufferers going into winter?
In winter? Like you mentioned, Pablo, for me, like you said, when I was in London, I was wearing synthetic, and any clothing or any diet or anything, it didn't affect it. But here in Melbourne, definitely through the winter months, I will try and wear cotton or linen. So stay away from polyester. I actually find that the heating really affects me, so I try to avoid putting heaters on as much as possible. And definitely, like in the lead up to winter now, I've really started making sure I'm consistent with my moisturizing. And sometimes, yes, I do need to go to the medications or the creams. So definitely, I do go to them. For me, also, having bleach baths. I'm sure you can give the right measurements for bleach baths for the person, but that's really helped me. So I do that 3 times a week through the winter, and moisturizing, and just being kind to myself again as well. I think that's always the important thing, because it does become that cycle through the winter months.
Yeah, actually, but the next question's for me. So we have had an increase. We've been asked about, do we have an increase in eczema sufferers in winter? And definitely we do. And we also are getting a lot more inquiries about where to go for mental health support. So I'll often recommend to people that they ask their GP to refer them to some sort of a counsellor or a psychologist that may have a little bit of experience in the skin. We really need to expand on this in Australia. There's not many specialists. I know in the UK they have psychodermatologists who are very good at dealing with issues of the skin, but sometimes for the whole family, counselling can really help. And even for the eczema sufferer, it can give them some tools to help manage their itchiness a bit better. And then that then doesn't hopefully lead to such severe flare-ups. But often people that have managed all year very well, they really need to revisit their dermatologist, put another skin plan in place, and maybe start using their topical steroids, hopefully only short term, because we know that there are things that can help you manage it. You just have to tweak things sometimes, changing up your products, going to something thicker in the winter, adding some moisture back to the environment. All these tips are really helpful. On our website, we always update the season with our tips. So we'll have our winter tips sheet up on our website for anyone that wants to have a look. Okay. Right, next question. Sorry, running on here. Dr. Pablo, how much research has been done on how eczema increases stress rather than how stress increases flares?
Okay, so it's too difficult to know what's first and what's second. Okay, I don't remember any study just specifically looking at how eczema induces stress versus how stress induces eczema. Certainly we know, and that there are studies that have been shown that when you change people from their environment, let's say a city that they're living and they move to a new city, the eczema changes. That's been described. There's enough description. So you could consider that if you're living in a very stressful city, let's say Sydney is stressful, although for me it's not very stressful compared to Madrid, and you go to, I don't know, Melbourne, that looks like a little bit more European and maybe it's less stressful, I don't know, it could improve. But on the other hand, you've got that in Melbourne, winter is more aggressive than is in Sydney. So then you have this balance that goes one way in one side and the other way in the other. Certainly, stressful events make your eczema worse, not the same day. Usually 2 or 3 days later is when the eczema gets even worse, or the next day or a few days later. And the relationship is clear, but what is first, so how much one way that the other, I don't think that anybody has done any proper studies. Well, I wanted to just highlight one thing about the bleach bath. I think that is a great idea. One thing that we're understanding more and more is what is called the microbiome. Microbiome is the bacteria that they live on our skin for thousands and thousands of years. And when this gets a little bit disbalanced, that could be another factor in eczema. So I recommend my patient with eczema not to take bleach bath, that I do. I recommend them to go to the pool, because a pool, a public pool, is a bleach bath. It has chlorine, the same chlorine that we put in a bleach bath, but I'm asking them to also get out of their house, move to the pool, do some exercise. I try to help with all this mental health that we were talking before, Claire, about how difficult it's doing sports. I think that the only good sport, no, it's not the only, but one of the good sports for people with eczema will be swimming. Because when you swim, you know, the water is nice around, is hopefully warm, although in Australia, your pools, they're colder than the ones that we have in Spain. They put it a little bit higher, and you're getting your chlorine. And at the end of this using the pool, rinse the skin, put a moisturizer, no soap, no nothing, just rinse the skin and put the moisturizer.
That's great, actually. And one of the things we say to people when they call is some people now live in apartments and they don't even have a bath. So that's really great advice about going to the local pool. My next question, again for you, Dr. Padlow, is my son has eczema, and when it comes to bathing him, I'm not entirely sure what I can use to clean him. He is very active. He gets messy and, you know, quite sticky, which is normal for 7-year-olds. But what soap do you recommend for him? I will try anything.
Yeah, so if the patient has eczema, the best is not to use any soap, even if it's dirty. The epidermis, as I was showing in those graphs, change all the time. So in fact, we have new epidermis, even you don't realize, every 4 weeks. So the worst stain that you're gonna have here is not gonna last that long. Okay, so clean the skin, use a soft-free cleansers and use moisturizer. A soft-free cleanser is a cleanser with no soap in it. And that's what you need to do. And if it's not too dirty, I will use just this only on the genital area, maybe under the arms. That's it, not touching anything else. And no more than once a day, no more than once a day. Bathing too often or for too long could create problems. Okay, so short contact, put in oil. Some people, they use this, put in some oils in the water. Just be careful when you're grabbing your kid, don't to sleep and create more problems for that. But having some oils could be helpful. But yes, as minimum amount, if a spot is very dirty and doesn't go well, then yes, you could use some soap in that spot, but will be a spot treating with a soap. The rest will be just a cleanser.
Okay, next question. I find red foods, especially chili, creates heat and causes an outbreak. However, all doctors and dermatologists say there is no link with food and eczema. Please advise. We get asked this every day of the week.
Okay, food. So anything that can make you itchy is going to make you itchy. And people with eczema, they feel those even worse. So if you take anything that could make you itchy because it's spicy or really is, you know, it's chili, yeah, that's going to make you itchy. But things that could dilate your vessels, the vessels, they have on the side a cell called mast cell. When you get red, alcohol is the classical one. Anything that could make you red, like alcohol, could make you itchy too, because the vessels, they get a little bit dilated, they release histamine, and then you have the histamine mechanism of itch. There are many others, okay? So food can affect eczema, but it's not an allergy. That is a different thing. So if we think that a food product is creating an allergy, usually those things what come with is that when you start eating those, when you put it in your mouth, it will make your lips or your tongue tingle or get itchy. And that's how we recognize many of the things that could be an allergy, is when people, they start to eat something and they noted the reaction. Then yes, there could be a consideration of a food allergy. Food avoidance is one of the most favorite things to treat eczema, because it's true there are people that they have allergy to proteins in the milk, or in some other things, or could be some fruit. At the end, what happened is that these people, they start to eat worse and worse and worse. And the only thing that we see is very severe problems of malnutrition and eczema that comes because nutrition is not good. And if nutrition is not good, eczema is going to get worse. So it looked like the food hasn't been removed, but really what is happening is malnutrition lead to severe problems on the skin.
It's a very, very complex issue, that, isn't it? The next question is for Claire. Thank you for sharing your experience, firstly. I have gone through a similar things myself. Did you find that during COVID and all the hand washing and sanitizer, you experienced more flares than usual? And what are you doing to prevent flares during the COVID and face mask season?
Yes, I did. I was working in hospitality at the time as well, so my hands were destroyed. I just, again, like the moisturizing, and yes, I did have to use some steroid cream on my hands, because especially with the sanitizer, and I didn't manage to find a sanitizer that did not affect me and make it a flare. Also the mask, like wearing a mask definitely flared my skin around my face. Luckily now we don't have to wear, or just on public transport here now. But the only tip for that was moisturizing. Unfortunately, obviously we can't not wash our hands. And in some places you walk in and you did have to sanitize, and I did end up saying I can't sanitize all the time, like I will wash my hands effectively and efficiently, but the sanitizing just I had to limit that because they were just broken on my hands. That's really, I know that's not the most helpful tip, but that's what I would say.
We do have information on our website about how you can help that process, and not as important this year, but it was very important last year, and we got lots of questions about it.
Absolutely.
Wonderful. Thank you so much for everyone who asked questions. That is unfortunately time on our Eczema Awareness Week More Than Just Skin Q&A webinar. Thank you so much to everyone who registered and joined us today, and thank you to those who weren't able to be here but still registered and asked the questions you've been itching to get answered. Thank you also to our amazing panelists Claire Harwood and Professor Pablo Fernandez Pinaz for donating your time and providing some really great insights into how you can effectively manage your eczema physically, but also mentally and emotionally. As I mentioned earlier, we have a 5-minute post-webinar survey we would really appreciate if you could please fill out, just to help us understand how you found the session and just to help us give an idea of how you would like to learn for future webinars. If you also complete the survey, that is beautiful or created will be included in the virtual goodie bag from all our wonderful partners who have donated prizes, supplying a range of discounts and goodies to help you manage your eczema over this season. There will also be a random draw raffle prizes announced, thanks again to our corporate partners. So we will be in touch with you around mid-May if you have been announced as one of the lucky winners. The video recording and handouts will also be distributed to the emails you signed up with, so refer to it in future and share with your friends, family or colleagues. Lastly, we appreciate that the webinar delved into some really sensitive topics. So if anything we spoke about has raised any concerns, please reach out to Lifeline on 13 11 14, and please don't hesitate to contact the EAA on 1300 300 182 if you need someone to speak to. Please remember you aren't alone. Thank you again so much for your participation, and enjoy the rest of your day. Thanks everyone.
Thank you. Have a good time. See you. Bye.
See you later.